Hello everyone, happy Sunday. Hope we're all having a lovely long weekend. Super excited to be having Dr. Kyla on to talk about solids. Hello everybody, popping on. Got lots of great questions that I've got, so if you've got questions as we go through, please ask away. Yeah, can't wait. We'll wait until she hops on and then we'll start asking away. So, we'll talk a little bit about, it was a long time ago, but 15 years ago, starting solids again. I had a book. This is very different than we've got someone like Dr. Kyla to be able to support you. And here she is. Oops. Starting. I think I'm crooked. Hello. How are you?
Good. How are you?
Good. Thanks for joining us.
No problems. My pleasure.
I'm so excited. I do get excited about a lot of things, but like I was saying to you, what I'm trying to do is create a little community for mums to be able to, if they're following me, find out, okay, they're going to start solids, who do they need to go to? They need lactation, who do they need to go to? Because, there's lots out there, but I think if it's all in one spot and they're following me, then, it's exciting. So,
Absolutely.
Basically I just wanted to sort of ask some questions, and then obviously would love to know what you do, like the packages,
Sure.
because obviously I have followed you, but don't need any help with solids. So,
I'm not point slightly.
No. Well, I did ask you about how I stop the treats, I was saying with my older kids, is it too late to, because I'm now in a whole world of hurt because, we're the old frame of mind of, it's a treat. That's not this, it's the occasional food. And now it's like they'll try and hide it, and they'll, anyway. So if they can get solids, but I think, finding you and seeing what you're doing is absolutely creating that sort of fantastic, healthy habit early.
Yeah.
So for me, it was a journey I had to do my whole life, but it'd be great if, be able to start it with kids. So.
And I think just to add to that, I think sometimes like we do what our parents did, right?
Yes.
With everything.
Yeah.
And sometimes we think like, oh, this doesn't feel right, but I don't know what the alternative kind of is. And I've just been talking to a few people lately who are like, it's just so nice to have a philosophy. Like, this is what I'm trying to do with food. This is what I want to teach my baby. I get it now. Like, that makes sense.
It's so important. And, I want to ask lots of questions about allergies and things like that, because I've had a lifetime of it. And I was really, really sick, actually, my whole life with asthma, and then as an adult, lots of really sick things. And I won't go into it because I was really, really sick, but it was food related. And no one told me until I was getting treated for symptoms. I was having surgeries, lots of congestion, like really, really sick. And it was dairy and gluten.
Yeah.
And that's not everyone. I mean,
and that's the scary thing.
That's right.
Because gluten and dairy get such a bad rap.
It does. And if you not have an allergy to it, or a gene mutation as I do, and my daughter has celiac, the whole thing, you should eat it. But if you've got whatever's going with us, it can affect so much. So yeah, like I said, we could talk about lots of different things. But what I'm sort of wanting to focus on at the moment would be introduction and what you provide for people. Because obviously, how old do you is it pediatrics like right up till 17 that you work with, or sort of more?
Pretty much.
Okay.
Our offerings cover pretty much kids. We're not, we don't tend to do kind of early breastfeeding, bottle feeding difficulties, but
Sure.
I have an intro to solids program, a toddler program, and then for kids who are extreme fussy eaters, we see them up until about the age of 15.
Oh, that's fantastic. Awesome.
Yeah.
So there's so much that you do, obviously, but let's just focus on introduction, because I've been doing lots of, if that's okay. I mean, I still want to hear about everything else you do, but there's not enough time in the day. So basically, so how, if people are looking at introducing food, so one of the biggest things was age. So for us, or even now, they say 6 months, but a lot of people are introducing early, like 4 months. What's your thoughts on that?
Our average age of introduction is too early. The evidence in Australia is that we're jumping in too fast. And part of that is because solids is fun. Like, we all want to feed our babies and share that kind of, lots of us love food and we want to, you know, have that kind of relationship with our kids. And if you're one of the younger ones in your mother's group, it's really hard when other people seem to be kind of leaping ahead and doing all these things, because like at that age 6 weeks is huge, right? So a baby who's 5.5 months versus 4 months, it's hard not to feel left behind or like, oh, am I not kind of doing the right thing here? So
absolutely,
our guidelines are around 6 months. But what I would suggest is that you're looking for individual signs in your baby. And to be honest, for most babies in Australia, that's somewhere between 5 and 6 months. There are babies who are ready earlier. There are babies who are ready later, but you'd want to be looking for specific signs. So essentially, you've got kind of the physical signs and the emotional signs. So physical signs, you basically want your baby to be able to really control their head movements. And most babies at 4 months are still doing a really kind of bobbly head movement every so often. And that's a real choking risk for bubs. So essentially, you want your baby to be able to turn their head to the side if they don't want something, or to kind of reach forward and move their chin forward if they do want something. And that can be puree or finger food. We can talk about that after. But that head control, and then being able to sit up without slumping to the side straight away. And that can be not necessarily sitting up unsupported. It's fine that you're using cushioning or padding in their high chair to support them, but you really don't need you really don't want them to be flopping side to side or back to front when they're seated. So physically, we're looking at that. And then emotionally, we're really looking at that, or development-wise, we're really looking for that reaching out, the real interest in food, trying to mouth things, really kind of intently watching people eat in a different way that they watch you when you brush your teeth, for example.
Sure. Yeah, well, that's really good to know, because, again, with what I do, I can start with the same age baby on the same night and the same sex, like a girl, and they'll all be different. So, you know, as you would know, every baby's completely different. So that's interesting. And I would say probably 6 months is majority, but a lot of people start early. So I'm like, oh. So in regards to what you can provide, like support, when people are looking at the introduction, how do they do that? What do they get from you, or what's the support?
Cool. So my main service is Baby Mealtimes, which is an online subscription or membership program. So you can join monthly, or you can buy a package for the whole Intro to Solids period. So it's $20 a month, or $99 for the thing. And that basically gets you access to my members only website, which is essentially every question that you've ever had about solids in a video, a picture, or a written form. And then they get access to a Facebook group with me to ask any question that they like, and that kind of ranges. So the babies in my Facebook group are generally between 5 and 15 months as a general rule. So anything that comes up around feeding and food, growth, weight, all the behaviours around food, throwing food, squashing food, spitting food, gagging food,
everything,
all that.
Yeah, interesting.
And then access to our Instagram's private page, which is kind of food inspo, ideas for babies. And so part of the membership, I guess, as well, is lots of people join because they're really terrified of choking. And that might be one of your questions coming up.
I was always, it was one of my top ones, actually, when I was as a small, parents of small children.
Yeah, it's it's terrifying. But we have lots of mums who are joining, lots of dads as well, who are almost debilitated by that fear, that they really can't get past that at the start, and knowing what it is and what to do and what sorts of foods. And so part of it is kind of guidance around that. There's a lot of videos on choking, around how to manage it. There's videos on what gagging looks like, because that's a big part of knowing what's normal for babies. And then a finger food photo gallery of, I think it's 170 at the moment, finger food by age and stage, and that grows every few weeks as I add more things into it. So
that's great.
It's essentially, it's just meant to be support so that your experience of solids is fun and enjoyable, and you can share that food and meal times, and that your baby can learn to love food without the stress. Like, I think most people at 5-ish months have only just really mastered breastfeed, or just really got the bottle sorted. Like, okay, cool, I know what I'm doing. And then we're feeding food as well. Like,
I know. So, and it goes from that whirlwind of, like, I think it's a whirlwind of a year with your first child, but that whirlwind No, and the whirlwind, and you're like, oh, it's my little baby. Oh no, they've got to actually eat food now. What? So yeah, it's interesting. But again, you know, we live in a world that we have all of this, and it can be a really positive support because there's lots of information out there that's just obviously way too confusing for people.
And I think solids is really overwhelming, but it's also the information is conflicting. People have very strong opinions on certain things. There's so much information that has changed. There's information that's coming from, you know, friends or parents or mothers-in-law, you know, and then there's the evidence-based stuff. And yeah, what I try and do is really translate the evidence that we have into something practical so that parents actually can work out what to do and feel good about doing it.
Yeah, and not be worried. So getting back to the allergy part, you know, again, you know, this has been my journey, and my children have milk allergies and celiac. That's taken me a long time to figure that out. But now I'm working with all these little babies, and it's presenting itself quite quickly, like really bad tummies. And I mean, I know we're not talking about breastfeeding and all that sort of stuff, but why I'm bringing that up is, so say we've got a bubs that's got all the milk protein, you know, all the allergies that start popping up. Do you have support for families that know that their baby's got allergies, or do you sort
Absolutely. I mean, part of it is tricky because you're in that process, in that time period. You have to ideally introduce all of those big allergens and kind of work out if there is an issue and kind of keep presenting them to prevent food allergy. So definitely there is, like, the components of our membership have, you know, allergy appropriate recipes and guidance in the group about what to do, what to avoid. But to be honest, for people who do have an allergy diagnosis, you'll need to see an immunologist or an allergist, and you will have that quite specialized support. So there's definitely generalized, and we have a number of, so we have an eczema guest presenter who's just recently done one. We've had an immunologist do one. We've had a food allergy dietitian do guest presentations in there. So there's definitely a lot of support, and a lot of families, you know, struggling with that too. But I guess individualized, like, it's not a medical service. So
no, that's right. And it's more, probably allergy is not the right word, probably more intolerance, you know. So it's not like they've had anaphylactic or anything like that. It's really just they know it's something's bothering their tummy, and then they're getting to the 5 months and actually just really worried because they've just got in control of whatever was happening, you know, breasts, because some babies are affected with what their parents eat through breastfeeding. Some babies aren't. But that's really good. So you can, like I said, it's not medical, but you can cater for intolerances and stuff like that, which is great. So what was the other one I was talking about in regards to enjoying food is, you know, obviously you help a lot in regards to pickiness, fussiness, because what ends up happening is you just do what's easy. And if that's a veg and a protein, you know, so obviously I'm sure that I saw somewhere that you specialise in that, or you enjoy that part of what you do with the sort of fussy toddler or the fussy baby.
Absolutely, that's my specialty. So it's not even that it's easy, it's because we have this innate need to feed our baby, right? Like, almost our own judgment of ourselves as a parent is, can I, you know, love them and nourish them, and lots of us nourish with food. So when you have a baby who perhaps has had allergy or intolerance, perhaps has had a tricky start with milk feeds, you know, you've had difficulties with failure to thrive or weight gain, or you know, you've been under pressure to get your baby weighed every 2 weeks, and there's just all of this stuff. It's so tricky to get back on track on your own when everybody's telling you, like, you need to feed your baby more, you need to give more, are you giving enough milk, come on, you need to have 5 breastfeeds, you need to have this, you need to have this, you need to extend it, and it's so challenging. And so historically, for the last 14 years, I've worked with extreme picky eaters. So I work with kids who are in my clinic who are very, very fussy. They find, you know, they come to me when they can't take a lunchbox to kindy because they don't eat anything that is safe to take. They are really worried about going to friends' houses with food. They won't eat what the family eats. They're down to kind of less than 10 foods. And they're the kids that essentially I'm trying to prevent developing now. So my new programs are about prevention of that.
Also, and that's what I'm talking about. So when you're talking about that, because even, you know, with my friends' children, there were some that would only eat white stuff. you know, like white pasta. I'm like, well, that's not really healthy, but okay. But, you know, or, you know, whatever it was. But again, it comes down to what they're eating, you know. So your mindset is that, for example, we're talking about something like that, that if you're introducing things correctly, it might
it's
stop
not correctly as such, but it's about the relationship that comes with food. So a lot of us feel like it is our job to get, or we're told by other people that it's our job to get food into our babies. And so even when we start, it's like this kind of unsaid pressure that it's my job to get you to eat this thing. And as you would know, as a person, or if you've ever tried to feed a child, it's impossible to make somebody else eat. Like you cannot put it in their mouth, chew for them, and make them swallow. But the advice out there is that it's our job to encourage and keep trying and, you know, make this a big thing. And actually what I believe, and the way I teach parents to introduce foods, is relationship based. So it's about this is something to share with your kids, and there are things that you can be in charge of, but it's never your job to make your baby eat. And actually what we expect for babies is sometimes really off as well, because some babies eat lots and some babies eat almost nothing for ages. And we get so caught up, and I think you would understand from a sleep point of view, we start to think like, okay, well, if they eat more, they're going to sleep more, and if they do this, and it becomes this kind of, we're trying to control everything in an environment that you just can't control. And so then you just feel stressed and overwhelmed and rubbish, and you start to hate mealtimes, and your baby starts to hate mealtimes, and you get into this space where you're just like, I thought this was going to be good. Like, this is not what I
too hard and stressful.
And so kind of that is like, I guess, developing this trustful relationship around feeding, however you do it, whether you do kind of finger foods or purees or whatever it is. But it's about how do we teach kids that mealtimes are an enjoyable space to be in, and that food is something you can explore without feeling worried or scared or overwhelmed, or without like sensing that from the person who's feeding you. So it's really about confidence for parents more than anything. And then that naturally passes to our kids, because we know what we're doing and we let them develop in their own time. And then that helps them to learn that food is something to enjoy rather than something, you know, to get really distressed about every time the high chair comes out.
Absolutely, yeah, absolutely. And that's the thing with again, with sleep for me, I keep saying knowledge is power. So if I can give the information to the parents to lay the foundations and provide support, sleep is a biological skill. So we have to have it for survival. So that's how I think about with sleep. So, you know, food.
And it's laying down the foundations, isn't it? And I guess in a way, it's the philosophy as well. Like, what am I trying to do? Because sometimes we get stuck with feeding in the short-term game. Like, okay, well, I can get this much in them if I distract them, or I do this, or I do this, I can get, you know, a couple spoonfuls more. And we get so very stuck in that short-term feeding space. And as they head into that fussy toddler age, which is really normal around kind of 15 to 18 months, we see their eating decline significantly more in those situations where you've had to control their eating up until that point. Because as toddlers get more and more independent and autonomous, the more they push back, and the more it becomes this kind of butting of heads rather than a kind of like, I'll do my jobs, you do your jobs, and we kind of get through it. And the same with sleep. Like, I struggled incredibly with sleep with my baby at the start, because I didn't know what I was doing, and I was trying to micromanage all of these kind of things rather than giving her the space to do what she needed to do and being in charge of the things that I needed to be in charge of.
That's right.
And feeding is the same, essentially.
And this is when I talk about to my clients, I'm very, very passionate about sleep, but I would say sleep and food and nutrition, the two most important things in life, well, you know, for our health. So it's the same thing as having the understanding of what we have to do as parents, providing the support, not leaving them, but the same with the food. Someone has just asked a question which is an interesting one, but I'm not sure if I'm sure you would know about it. Her question, Benet, said, are there sleep promoting foods for 7 months old? So is there sleep promoting foods, like having protein, like people talk about that, like protein at night, or don't have milk, sort of things like that? Is there anything?
To some extent, but it's not the difference between sleeping and not sleeping.
Right, yeah, for sure. Yes, because I hear
foods high in tryptophan tend to promote sleep, but then they're literally, if you've got sleeping difficulty that is impacting your family life, the type of food is going to make zero difference.
But I do wonder sometimes, because, you know, some babies are find it a little more harder to want to sleep. And then when we're right at the pointy end and then all of these things have worked out and there's this one little spot, I often wonder if there's a food intolerant nut. You don't reckon? Nothing like that.
If they're in pain, absolutely.
Yeah, but not just waking
like,
and not wanting to go back to sleep.
Yeah, and things like babies who are like, it is totally appropriate to feed your baby meat at night. There is no evidence around protein and meat particularly, and night sleeping and digestion. The body is very, very clever in how it does digestion and works on things. If you have a milk intolerance, for example, and that baby is very gassy and very uncomfortable, they're having really mucousy or bloody poos, then definitely that's going to affect their sleep because they're really uncomfortable. But that's very different to being able to digest different foods at different ages. And that's an interesting one because that myth pervades so much of the sleep advice out there.
It does.
And I can't believe how many kind of big people publish like guides that talk about meat, and it's really incredible.
And I just, like, for me, you know, now that I'm a sleep expert, is that it's all science-based stuff. This is researched on human beings. Biological stuff, which would be food related too. So that's the interesting thing for me with sleep. When I see people put things out, I'm like, well, that's not even fact. But people follow that, you know, it would be the same for you. And that's where I'm always about science-based stuff. You know,
it's desperation, isn't it? Like when you don't have a baby who sleeps, you will try anything. And if somebody says to you, like, oh, you need to feed them bananas and a mixture of, you know,
of course you would.
Rice,
absolutely.
Like, well, bloody hell, I'll do that because I just need them to sleep. But it's not. It's got nothing to do with that.
Oh, that's really good to know then. Really good to know. So the other thing we were talking about before is, again, probably this is my question towards you. So say, for example, again, biologically by 6 months of age, babies are capable, whether it's possible, because they've had some major shifts and changes. But in regards to food, I always am concerned, obviously, that they're not hungry. The difference between finger food and, like, do you suggest one over the other or both? You know, not baby led, sorry, not finger food, like baby led.
Baby led weaning, So my program teaches a combination of the two, of puree and finger food for a couple of reasons. There's real benefits. So for those of you who are potentially very new to solids and not sure what we're even talking about, the kind of traditional way, and perhaps the way that our parents would have fed us as infants, was that you would puree up food. So you would cook it or prepare it as you normally would, blitz it up, and make it into a texture that a baby can eat from a spoon. And the opposite of that is this kind of newer way that's gained popularity, probably more so in the last 10 years or so, called baby-led weaning. And the idea with baby-led weaning is that you're offering finger foods and you're not using puree. You're not offering your baby a spoon. You're just giving them finger foods from the start to practice and develop their skill. And baby-led weaning tends to suggest around 6 months that babies have kind of developmental skills for that. Now, the main nutritional reason that we introduce solids at around this point in time is because of babies' increasing iron requirements. So after 6 months, babies don't have enough of their iron stores that they got from their mother at birth, and they don't have, they're not getting enough iron from breast milk or formula alone after the age of 6 months. So from a nutritional point of view, the reason that we're adding food is to provide that extra source of iron.
That's good to know too.
Iron foods that we're talking about are essentially most protein foods apart from dairy. So things like meats and chicken and fish and eggs, kind of nuts and seeds and lentils and legumes. There's some in kind of chia and rice cereal is fortified with iron, all of these kinds of things. Now, if you think about most of those foods, babies at the beginning can swallow very simple textures, very soft, very kind of smooth textures. Meat, chicken, fish, all of these things, nuts, seeds, lentils, legumes, they take a lot of skill development, and babies aren't in a space for months to be able to eat effectively finger food like that. They can practice on finger food. So one of the things that I love about baby-led weaning, or this finger food kind of stuff, is that babies can feed themselves and they can be very much in charge of their own body. They can explore and learn to enjoy food without kind of being pushed into eating, which is great. But one of my concerns about just doing finger food is that from an iron point of view, it's very, very difficult to get foods that are appropriate textures for babies to actually eat.
Okay.
And babies, 6 months to 12 months, they have higher iron requirements than an adult male. Like it's quite a lot of iron.
Wow.
Because this is really, like, iron is about immunity and growth and brain development and blood cell quality. Like, there's a lot of important things around iron. So, and there's nothing damaging from feeding your baby from a spoon either. So, like, if you eat breakfast cereal or yogurt or soup as an adult, like, you use a spoon. It's a totally appropriate skill to have. So the way that I teach people in baby mealtimes is about using a combination of the two to kind of meet iron requirements, but to also give babies that chance to get messy and enjoy that finger food. But as a general rule, most finger foods aren't suitable for actually eating and swallowing for babies until after 6 months. So you've got to do a combo at least up until that.
That's interesting, and that's what I'm thinking when they just do baby led at 6 months. I'm like, are they actually getting enough? That would be my parent brain going, at least if they were eating, they were happy to eat, you knew how much they had. So that's fantastic.
That's an interesting one though, because I think sometimes that also fuels our own anxiety about feeding, because in the same way with kind of breast or formula, like, it's impossible to know how much a baby's taken from a breastfeed, but you can actually see it from a formula feed. So some people feel better seeing that, and I totally get that. But that fuels our need to kind of control or manipulate how much it is. And this is why where people have concerns about puree is when you make up a portion and you get kind of sucked into trying to get your baby to finish that portion, because that's what you've kind of been told is an appropriate amount. And so people then kind of try with a spoon to kind of, encourage their baby to eat more. And what I'm really all about is the only person that knows how much that baby needs to be full is that baby. There is nobody, no child health nurse, no sleep expert, no dietitian who can say that baby needs to eat 3 tablespoons or that baby needs to eat half a cup. Like, it just, and it's not normal for babies to eat the same amount all the time. It's normal for them to sometimes eat lots and sometimes eat little and really listen to their bodies. And that's what we're trying to teach them with solids. That's a really huge passion of mine, particularly. So my PhD is in childhood weight management. And what we're seeing is so many people feeling like their baby isn't eating enough or their baby is eating too much. And so some people are trying to limit it, some people are trying to increase it, and we end up with all of these babies who have difficulties, or all these children who have difficulties regulating their own body weight, because they've always had to rely on somebody else making the decision about how much. And it frustrates me, because there's advice out there, like at 9 months you should be eating half a cup. At 12 months you should be having this portion.
Exactly.
That's rubbish.
It's crazy. And the thing is, like, we have the 3 girls, and my husband's a bit old school. Like, he's like, you have to eat your meals, which my dad was like. But I'm a woman who has had to have my own journey into, healthy eating and stuff like that. So I'm all about, you know what? We present them with healthy food, and they've got to eat until... If they leave some on the plate, that's not old school thinking. That is like, I've had to go against my grain with that and go, you know what, they're girls, and if they're birds that they're eating and they're having their veggies and stuff like that, then they're having control of whatever their, amount. But getting back to those bad food things, they would eat bad food all the time if we presented it to them. It's really upsetting,
And again, that's kind of what the toddler program, so toddler mealtimes is my step up from baby mealtimes, so kind of baby 12 months to almost 4. But part of that big stuff is about this relationship with all food, and how do we teach our kids this kind of variety and moderation message without harping on at them about it, because I think my goal for families in that program is that you can go to a birthday party and there can be lollies and cakes and chips and whatever, and your child can eat some of it and then stop when they're done and get back to the games. And we're really trying to avoid raising those kids who are standing at that buffet just eating like they've never seen.
And you see it
again. Oh, absolutely. It's more common than it's not common. And there's absolutely no judgment around that. But it's just...
No, definitely not.
Because parent like we were parented. And that's exactly what my parents did. They said, that's enough. That's enough of that food. Stop. If you want something else, you can have an apple. And so
I talk about this a bit too. And I talk about, I'm a bit of an oversharer, but, that's what my parents did. And so then when I left home, I just went nuts. and I just ate all, like put on 7 kilos, and I had to go on that journey myself, but it wasn't regular. I didn't have my self-regulation. Like, this is what you're having, you can only have that, and that's the way that they did the best that they could. But I'm trying to.
And in a way, what I don't even want, what we want is that actually we're raising kids who aren't having to use willpower to stop. They're actually just feeling good and satisfied.
Yes.
And so they stop when their body says, I don't want any more.
That's
and we learn to override that so much with the kind of messages that we get and the way that we're taught about food. And it's really critical that if we start that in toddlerhood, we can actually prevent, and even we can prevent it in babyhood, you know, even just offering fruit or yogurt as like an extra food to top your baby up is one of the slippery slopes with that.
Oh, really?
We feel like, well, if they haven't eaten these things, what else can I get them that's like a guaranteed special thing that will fill them up? And it often tends to be that fruit and yogurt. And there's nothing wrong with fruit and yogurt, but it's about including that into what you offer your baby as just another food, not as a special or a backup or a top-up or their favourite thing that you're going to hold out and kind of get them to eat the savoury thing first. So it's actually about that whole, how we think about food as well.
Yeah. Oh, it's fantastic. It's so exciting. I can't use the word exciting all the time, but it's just, you know, it is very fantastic. So it's everyone that that's interested in your packages, you've got a is it Instagram, Facebook, or web page?
So Instagram, so Dr._Kyla on Instagram, or you can head to my website, which is babymealtimes.com.au.
Great. Awesome. That's exciting. And did you say that you have a practice as well?
We do have a practice in Perth, so I'm not seeing clients at the moment, but my colleague Lauren is. So we see kids. We actually see kids Australia-wide now. The coronavirus has given us some more video skill that we didn't realise was actually super effective at working with. So we work with babies who are very fussy, but also kind of into the toddler and the older years as well. So we have a clinic here in Mount Hawthorn and in Canning Vale, and we have in Perth, and we see other kids via video link too. For those
that's fantastic. So thank you so much.
No props. You've got a couple of questions on the bottom. Do you want me to answer?
Oh, did I? Sorry. Have I? Oh, God. See, I didn't even see them. Better ask those. All right. I've always been told no yogurt before bed. So if Bub can tolerate dairy, what would be fine? If Bub
totally
can tolerate... What's that? Would be
totally
fine. Totally fine. Timing of eating solids milk affecting sleep for babies 6 to 12 months.
Nah. Really? So essentially with your 6-month-olds, you really want to start slow. So actually I'm recommending kind of 1 meal a day as you find your groove for the first kind of month or so. You can move up to 2, but most of the time, like, you are still continuing to milk feed as normal, and solids are on top of that. And actually solids are not meant to address hunger at that point. Solids are, from an experiential point of view, learning about food, learning how to manage the textures and the flavors. It's really like 2 tablespoons is not going to fill a baby up overnight. Like that's not going to happen. So really the timing of that is irrelevant. I would actually generally for those kind of babies up until 8 months, I'd be suggesting that you're offering solids within an hour of milk feeds to start with. And that can be, if it works for your family, 10 minutes after that, great. If it works up to the hour after that with your awake periods, whatever.
It's fine,
And then really after that kind of 8-9 month mark, as you're heading more towards 2 naps a day, you're kind of looking at a milk feed and a solid feed for each awake period as a general rule.
Yeah, that's fantastic.
But there's no reason that you can't give your baby at 30 minutes before bed or an hour before bed.
It makes no difference, And look, I integrate that a little bit into my sleep, because I think, you know, nutrition is obviously very important, but it's interesting to know about the up to 12 months, which I knew about. But I often said sort of up to an hour, because I would think that maybe they won't be hungry enough to be interested in the food. But then if they do eat it, then it's fine. But
at that stage, though, they often don't associate early on food with fullness. Like, that is still part of that learning skill, because when you first get in the high chair, if you're really hungry and you don't have that skill bit to be able to manage that kind of amount, it just gets really frustrating. And kids start to learn, like, why are we doing this again? I don't want to do this. Like, what is the point? You actually want them to click kind of faster and have that, like, this was fun and now I feel quite good, so I'll do that again next time. You don't want them to be ravenous by the time that they get in there.
Good, great. That's really good. And like I said, all positive around it. Okay, Sally, are there ways you can tell if your baby is not getting enough iron?
It's tricky. So generally under 12 months, it's not easy to tell, but it's also not a highly likely thing. So if your baby was really not taking to solids, it would be something that we would consider. Like they were kind of 10 months and still really not swallowing anything, then it would be something, you know, for us to keep an eye on.
Yeah.
For older kids, it's more around lethargy, kind of sleeping more than normal. They can have dark circles under their eyes. They can tend to get sick really often. They tend to be the kind of typical signs for kind of older babies. And the only way to really tell if your baby's not getting enough iron is to actually do a blood test. So your GP has to order a test, which definitely, like if you've got a preemie baby who has been discharged without a proper iron supplement, they're not really taking to solids, you know, at that 8-9 month mark, then it's probably something that I would recommend you actually do talk to your GP about, because preemie babies particularly are not born with as much iron as term babies. So it's something we want to be on top of, because once you get low iron, it's virtually impossible to bring it is impossible to bring it back up with diet.
Oh, really?
So once iron is at deficiency or anemia kind of levels, then you have to use a supplement,
okay.
which is fine.
Yeah.
But it just takes some of that pressure off. If your job, you actually don't have to calculate iron requirements. Your job as a parent is to offer your baby a high iron food at each meal.
Okay.
It's up to them how much they eat of it, whether they eat it, whatever. Your job is to offer it each time, and that will meet iron requirements.
Yeah.
All you need to focus on.
Gotcha. Next one. Can I continue to give my baby rice at night and the baby's 8 months of age? Sure. Yeah, good. Excellent. Belinda, can you give some examples of finger food babe-led weaning?
Okay, so when you're first starting, essentially for your baby-led weaning, you're looking at finger-sized food, so 1 to 2 adult kind of fingers, that length and that width, because when your baby picks it up, they can only use their whole hand, and it has to be long enough to stick out the end. So some of my favorites at the very start are things like pumpkin, sweet potato, zucchini, eggplant, potato, cauliflower, broccoli, that kind of bigger pieces, but that they're steamed until they're almost about to melt. Your baby can pick them up, but they're smushable in their mouth. And that's the kind of texture that we're aiming for those.
So really just the taste and stuff, and no choking hazards. Excellent. Okay. Mama Webb, any tips on first food to introduce to your baby to? So same thing, I'd say, would it be? If it's puree or not?
So from a finger food point of view, those kind of ones. But what you really want to do, what most people get stuck on, is that they introduce vegetables first, which is great. Vegetables are very nutritious, but they have almost no iron. So sometimes we get stuck on veggies for just too long, because it's the thing we feel confident about, you know, like cooking and pureeing meat feels uncomfortable, like I don't know what to do with these things. So what I would suggest is you use a veggie first, so like something like pumpkin or carrot or whatever it is that you like, especially if you're doing a puree on top of that, but you start to add in those high iron foods. So even things like tin beans, for example, are a great one. Even like red kidney beans with no salt can be a good puree that you can use, and you can actually start to add meat and chicken and fish and all those kind of foods fairly quickly to kind of cover off on those iron things. So start easy with things you feel comfortable with, but just don't get stuck on just fruit and veggies for too long, because they have no iron.
We have iron, okay, that's great. Oh, this is an interesting one, Sam. To add iron into foods, I've heard to grate frozen liver into puree. Is this something you recommend?
You can definitely do that. I've got a video on my site about grating steak into puree as well. Liver is a little bit trickier because liver has really high vitamin A levels as well. So liver is one of those foods that is very nutritious, but you can't feed your baby. It's probably one of the only things that you can't feed your baby every day. So you just want to be quite careful about using that in high quantities.
A lot.
But it would give a nutritional hit, absolutely. Some people would feel revolted at the thought of cooking liver and grating liver, so you don't have to do that either.
Don't have to do it.
It's not essential.
So meat's fine. Okay, 2 more. Alicia, when doing baby cereal, should you spoon feed or offer a loaded spoon?
Totally depends on what your baby says to you. Some babies will sit there like a baby bird, and they will open and close and welcome it into their mouth. You always want to give your baby to give you a clear cue that they're willing to take it. You never want to have to trick or jab or wait till they yawn or do anything like that. You're totally following their cues around it. Some babies love loaded spoons. There's a brand, these kind of sized ones called Gutensils. And they're super helpful for preloaded spoons because these silicone bits hang on to puree and babies can feed it. if you're using a longer spoon, and I know Elsie took my longer spoon out this morning, I saw it, but if you hold your spoon at the end of the spoon, so that you leave the bit before the dip, so let's say this is your spoon and this is the scoopy bit, if you hold it here, you actually give your baby room to grab it as it comes to their mouth. So if they help to guide it to their mouth, that can be really helpful as well.
That's great.
So there's no right or wrong way.
Baby led by that, without the forcing or the aeroplane forcing to do. Like
no aeroplane.
Okay, last one. What brand of chicken beef stock do you recommend that are low in sodium?
It's virtually impossible on our market. So regular stock is not appropriate for babies under 12 months. Reduced salt stock is not appropriate for babies under 12 months. The load on their kidneys is just way too much. There is a brand of beef stock by Campbell's, I think. It's the natural. It's got Manu to do something with. And that one has no added salt. And there's a veggie stock by Maggie Beer that has no added salt. But the rest of them are just too high.
So just something with no added salt, basically.
If you're cooking something just for your baby, just use water. Like as a stew kind of thing. But if you are cooking a family meal, you could definitely use those stocks, or you could add your own salt after. And I think the next question from Alicia, when cooking recipes, should I be avoiding salt altogether? Yeah, for 12 months, you want to have absolutely no added salt.
That's good. That's good to know. Yeah. See, so much to know. Excellent. So have I forgotten anybody? They were all tucked under there, and they would have no, any other questions?
I think that's all of them.
That was it. That's wonderful. Well, thank you so much. That was so informative, and now everyone knows that you exist. Well, if they didn't before, I'm sure they did now. But thank you so much. I really appreciate it, and have a lovely weekend.
You too.
Okay, see ya.
Thanks for having me. Bye.
Bye.